Jump.
Hi, so I would like to thank all our viewers who are here with us today to hear the COVID-19 update for retail businesses and offices. Thank you very much for joining us. We are excited to have you here today. My name is Celia Golden. I'm one of the Assistant Deputy Public Health Officers, and I'm happy to say we're going to start off with Dr. Lisa Santora, the Deputy Public Health Officer for the County of Marin. She's going to keep us up to date with the epidemiology. We also have today Sandra Rosenblum, who is our chief nurse who does our commerce investigations. If you have had a positive case at your business, you've probably spoken with Sandra and know her well. And we also have Max Courtney.
And then we will be possibly having Sandra. Oh, I'm unstable. We're all unstable. Our internets are unstable. Sandra joining us as well, depending on whose internet is most stable to provide this update. So you can jump ahead, yeah.
Definitely.
And thanks again to Max Corton, who's on the team and has been leading Marin Cover's efforts, and the members of all of our commerce groups. It truly takes a village to get us back on track after COVID has been introduced into our lives. So this is an update of cases per 100,000. This is one of the things that's very important to the state because it's part of our monitoring list. We are still on the state's county watch list, and that's because our cases exceeded 100 cases per 100,000 residents in the past 14 days. We hit a high of 281 cases, and this did not per 100,000, and this did not include San Quentin. Today, we are at 177 cases per 100,000. So we're seeing ourselves shift down, and we are, it feels like we're stabilizing at this point. Again, it really is reinforces the importance of sheltering in place, face covering, physical distancing, all of those tools that we have to prevent transmission. What you'll see here as well is that in the news there is something about waivers where counties that are above 100 but below 200 cases per 100,000, health officers can consider offering waivers for schools. So that's something we'll be exploring this week. And again, trying to maintain an equity-centered lens in Marin County as we look to reopen schools and ensure that all children in Marin have access to safe in-classroom instruction. So that will be something that you'll be hearing more of as we move forward. So the other side of the slide just shows that we are on the county monitoring list. So you can jump ahead. And this just shows that our cases continue to rise. What is the highlight to me of this is that we continue to see most of our residents who are diagnosed with COVID-19 recovering, and we continue not to see a parallel increase in hospitalizations. Our hospitalizations are staying steady and hovering in the 20 range, and so that's something that again reassures us as we're moving forward. But we monitor this closely, and as well as we continue to monitor deaths due to COVID-19, and we're primarily seeing that among older adults in our community, primarily in those who live in long-term care facilities, who account for more than 70% of deaths due to COVID-19 in Marin County. Jump ahead. And this just shows the trends of our cases. This goes back to March, where we did not have significant access to testing. It also reflects probably the community spread of COVID-19 in March. And so as you've seen, as we began reopening from shelter in place, and this was never unexpected, this is exactly what we expected to see, is when we reopened Marin County, there would be more interactions that would result in the transmission of COVID-19. We were hoping that now, post 4th of July, where our community is now seeing that when we engage in large gatherings and engage in family reunions and are not following guidance around face covering and physical distancing, that we will have surges, and we're hoping that this surge that we've seen nationwide as well as across the state reminds people of the importance of remaining vigilant and practicing COVID protective behaviors as we move forward. And for me as a parent, these protective behaviors are critical to allow school kids to get back into the classroom. Kids back in the classroom is one of the key parts of getting back to our new normal, but we all need to work together to make sure that we are not unnecessarily exposing ourselves to increased risk for COVID-19 transmission. So really avoiding only engaging in essential behaviors and activities, and avoiding non-essential behaviors and activities will always be the key to us. If you follow the world and COVID-19, you'll have seen that Melbourne, Australia, has now entered back into stage 4 restrictions because they've seen a large surge in COVID-19. And that's what we need to be prepared for. And that's what we'll be closely monitoring again. So they are in their winter. August is their typical flu season. And so they are engaged in more indoor activity, but then now they've had to significantly restrict their activity in the Southern Hemisphere. And that's, again, what we have to prepare for in the months ahead as we move forward. We can jump ahead. Oh, and the only caveat to that slide, you don't need to go back, but the caveat to that slide is that there's been a lag that we've heard nationwide in test results. And so right now we are still getting results from the week of July 14th, where we saw Quest and other commercial laboratories have major delays where we were waiting 15 to 20 days to get people's results. And so we're hoping to clear out those backlogs and hoping not to see any unknown unexpected bump in cases. You may have heard that there's an issue with the state reporting system. That does not affect Marin County because we do not depend on CalReady to advance our case identification and contact tracing efforts. We review information we receive directly from laboratories and enter that into our database to initiate our contact tracing processes and case investigation processes. So we believe that we have not been affected as other counties may have been, who have not been as proactive as Marin County has been in case identification and not depending on our CalReady, which is the state database system. And then this slide just shows you where we continue to focus our efforts. We see the largest cases in San Rafael. As many of you know, the canal area of San Rafael is largely populated by an immigrant, low-income population where there's crowded housing conditions that really create the environment where COVID thrives, is when there's many families living in a single house, sharing space. It's an ideal environment for COVID transmission, and that's what we continue to work on. And we have launched in partnership with community-based organizations, the City of San Rafael, Marin Community Clinics, Marin Health, and Kaiser, a partnership to address the canal outbreak and to begin mitigating the outbreak. And again, with the same hope of getting these communities as well to return to school, even communities that have been affected by the outbreak. And one of the things that we'll still be challenged with is herd immunity. We don't have great information or research regarding antibodies yet. I know people still are tracking that. And so that will be something we continue to struggle with as we try to get schools back online, especially in areas that have had an outbreak, identifying how we can safely return students and teachers and staff to school environments in an outbreak setting. So that's an area of continued focus for us. The next slide. And you can find all of these slides on our website on coronavirus.marinhhs.org. And I think the links are on these slideshows that we'll share with everybody. And again, I look at the data set myself on that website, so it's a trusted resource. And this just shows the racial inequities of COVID-19, driven primarily by the income inequalities and wages that many of our essential workers who are low-income members of communities of color across Marin County. And we're seeing disproportionate impact across different sectors. And again, it's primarily not necessarily driven by the sector itself. It's driven by the wages of those who work in those sectors, who are forced to live with multiple family units in order to afford market rate housing in areas like the canal area of San Rafael. And just a caution, not just to focus on the canal area, that need to share housing and live in crowded housing conditions is across Marin County. And again, it really disproportionately affects communities of color across Marin County. So you'll see here that while 16% of our population in Marin are members of the Latinx community, almost 75% of our COVID positive cases are among residents who identify as Latino or Hispanic. And now 51% of our hospitalizations are among Hispanic or Latino residents of Marin County. So the reason why we see a lower rate of hospitalizations is because the median age of those individuals who self-identify as Hispanic or Latino are younger. So it's a younger population. You'll see the term care facility, and 75% of the deaths in our community occur in these facilities, and which is why we have very targeted efforts on preventing outbreaks and working with staff to ensure adequate infection prevention and control mechanisms are in place to prevent this. But this is inextricably linked to essential workers. The workers in many of these facilities are low-income residents from communities of color who work multiple jobs in order to afford to live in or near Marin County. So the residents, the staff who work at these facilities often live in lower income communities, not only in Marin, but across other counties in the Bay Area. You can jump ahead. And this is where I'm going to pass the baton over to Dr. Golden. Thank you, everyone.
Thank you, Lisa. This slide really is showing us the occupation of the cases here in Marin, and I just like to point out that we have the highest of cases among the highest occupation that's listed by our cases is food service, followed by construction, and food service is restaurant workers basically, followed by construction. We also have grocery store workers, and we're also seeing housekeepers as well are also showing up as our 4 most frequently cited occupations. Next, please. One of the important things that we would like to do is to remind people to be tested. We have a recommendation for essential workers to be tested once a month here in Marin County, and this is a reminder of the actual website that you can go and get tested at. We have a new testing vendor of Color, called Color at the Civic Center, and you could. It's again a scheduled event. We have some drop-in sites around the county as well, and you can find this information on our website. Next slide, please. Next I'd like to invite Sandra to go through the steps that we take when we identify an employee who is COVID-19 positive. Sandra, would you mind taking us through this?
Sure. So when somebody tests positive, within a day or two, they're generally contacted by contact investigators who will ask them various details about their lives, like where they live and who they live with, and also where they work. So when people indicate that they work at a certain business, contact investigation will let us know, and we'll reach out to the business to help them sort of troubleshoot the situation in the workplace setting. So in this case, sort of the workplace becomes the client. The contact investigation takes care of the needs of the individual, and we work with the workplace. So you could conceivably get a call from us letting you know that an employee has tested positive. Generally, the employee will have let you know themselves already. And then you'll get a call from us to talk about next steps. Next slide, please. Thanks. So basically, you'll hear from us when somebody tests positive for COVID, and they were in the workplace during their contagious period, which is generally 48 hours prior to their symptoms starting. And if they don't have any symptoms, then 48 hours before they had their positive test. Next, please. So if an employee notifies you that they have tested positive for COVID, please let us know. Often we know, but many times we don't. And that's because people don't always divulge their employer when they're interviewed. So we don't always have this information. Another reason we might not have it is they reside in another county outside Marin. If you talk about this to other employees, be sure not to use the name of the positive person. In a small workplace, it might be obvious, or the person themselves may have discussed it with other coworkers. But you should not be divulging their identity. Now, they may give you permission to do so, in which case it would be okay to do that. One of the things that we'll be asking you about when we call is who in the workplace has been within 6 feet of this person during their contagious period for more than 15 minutes. Those people will be quarantined, excluded from work for 14 days from their last contact with the person. We'll also advise that they get tested after 5 to 7 days after their exposure. That gives enough time for the virus to develop in their body to trigger a positive test. If you're thinking about your workplace right now and kind of thinking who might be caught up in this, this is a time before you have any positive tests at all to really look at your workflow and the organization of your space and see if there are people who are unnecessarily close to each other. If you can still do the work that you're doing without people being in that 6-foot bubble of each other. Because even if they're wearing masks, even if it's outdoors, that 6 feet is the measure that we use to determine a close contact for COVID. The folks who have tested positive can return to work 10 days after their symptoms started, as long as they have been free of fever and significant respiratory symptoms for 24 hours. So the 10 days is a minimum. If they're not better yet, then they don't come back. But 10 days after their symptoms start, if they're ready to work, they may return. They do not need to retest. For a while, the CDC was offering retesting as a possible way of determining when people could return to work, and that has since been rescinded. And now the only recommended way to determine return to work time is 10 days after symptoms start, or in the case of someone who doesn't have any symptoms, 10 days after their positive test. Can we go to the next slide? Right, well, we can actually skip over this one since I'm sure everyone is well aware that employees should be masked and wash their hands and so on at this point. So let's think about, though, preventing. We are talking about what we'll do if somebody tests positive, but there are things you can kind of do in advance to prevent this from happening. One we talked about, which is to separate workstations by more than 6 feet. People, especially in a setting where there's a lot of movement, may be passing by each other, and that's okay. But they shouldn't be in a situation where they are obligated to stand or sit next to each other for a period of time. You can also sort of improve airflow by opening windows and doors if that's feasible in your setting, requiring mask usage, considering staggering the hours so that not everybody is in a space at the same time. And a lot of times people will sort of put in these measures to really control the way people are using the space during the workday. But there are 2 times when things fall apart. One is during breaks and meals. People will often sit down together. They'll maintain space during work time, and then they'll sit down together and eat. That will make them close contacts of each other and could leave them vulnerable to quarantine. The other thing is to think about how employees get to work. If they're carpooling, they need to know that they will be close contacts of each other. Sometimes it's not avoidable, especially in Marin where there is not ideal public transportation. But one thing they can do in the car to make things safer is to keep the windows open to make sure that everyone is masked. They will still be close contacts, but they could limit the spread of virus that way. Next slide. Okay, and this is our website. I think that's it.
Yeah, we just had some, thank you, Sandra. We just have some information here for people who would like to get some more up-to-date information from the CDC or from our Marin website, and marinrecovers.com. And I think it would be helpful to take some questions. I noticed we already have a question here. What evidence is there that office environments are high risk? Our office supports over 100 businesses for co-working and meetings and has over 35 safety protocols in place and no cases. Can you direct us to any account or state documents that show justification? The blunt instrument of shutting down the entire office sector is devastating many office-based businesses, including ours. Lisa, did you want to comment on this?
I don't think Lisa's there right now.
I don't think so. I don't think so
Okay.
either. I can kind of briefly touch on it, and then I don't know if there's anything else to add, but from your side of sort of the epidemiology. But I think at least from the guidance side, Marin is currently on the state's watch list, and part of being on the watch list is that the state required the county to close any office space except for essential. Let me pull up on my screen what the exact wording is. You're probably all aware of this, but office space for non-critical or non-essential sectors were required to close indoor operations for office space, except to perform minimum basic operations. And you probably already read this, but minimum basic operations were defined as operations necessary to maintain or protect the value of the business's inventory and facilities, security, safety, sanitation, payroll, employee benefits, that sort of thing. And for industries that we are allowed to have open by the state, then the county has guidance, that can be more restrictive than the state guidance. But in this case, and in all cases, we're not allowed to be more lenient than the state. And so for office space, we are just deferring to the state guidance. We don't have any more restrictive guidance than the state does. And, I'd say as a general theme, if you look at the sectors that were closed by when counties joined the watch list, typically they addressed indoor activity that, most activities are allowed to take place out of doors, but most indoor activities were closed just because of the increased danger of transmission indoors. I don't know if Sandra or Celia, if you had anything to add to that.
No, I think that's what the thinking is. It's the indoor transmission that's causing the concerns.
I think it brings up an important issue, which is that business owners of all sorts are really suffering right now. So many different types of our workplaces are really impacted by this. And it really just can't be, it has to be acknowledged how much pain all around this is causing. In terms of offices being particularly dangerous, I wouldn't say that that's the case more than any other indoor sort of space. A lot of businesses require a lot of contact with the public or require people to be in kind of a close space together. But I think that we can, what this is really about is making businesses safer. What's happening sort of on the larger scale of what's open, what's closed, what the policies are happening in sort of a larger arena than the one that we're functioning in right here. And our focus today really is more about how can we function at our best given the constraints that we have right now.
That's well put. Thank you, Sandra.
Yeah, are there
Any
any
other
other
questions?
Is there another? My piece may may be done, actually. I'm not sure what's on the next slide.
I think it's just the commerce email.
If people want to put their email addresses in the chat, we can send out a copy of our workplace guidance document, as well as flyers for the new test site near the Civic Center.
Yeah, and if there are any other questions, and I mean, if folks do have questions about the guidance itself, I'm happy to answer those as well. But if not, that's fine too. Looks like there's not any questions. Well, really appreciate everybody for joining. Anything else, Celia, before we wrap up?
No, just thank you for attending and spending some time with us. And as Sandra said, it's been very difficult on the business community, and we're really hoping that if we can get this, get the case count down, that we'll be able to start the journey back to reopening. And so all efforts that we make as individuals, the top 3 things we can do is wear a mask, stay 6 feet away or more from absolutely everybody, stay away from large crowds, and then and perform hand hygiene. We really would like to, believe me, we want to get the community going again. And do we anticipate lifting the office shutdown? What timing? Again, it's going to depend on our case counts, which are going down right now. Right now, we're heading down, so we need to really stick with this, with the efforts to suppress the cases. And so hopefully we're going in the right direction. I don't have a date, but we are heading in the right direction, which we weren't a few weeks ago, a couple of weeks ago.
And Chris, I think, you know, one way that you can track this is if you look at the, you know, there's on the HHS website, all that, the data is displayed and updated daily. And so we need to be at below 100 per 100,000. That's sort of one of the key indicators. There's obviously other indicators like the number of hospitalizations and deaths in the county. But I think, you know, we were well over 200 and now we're below 200 per 100,000, and we have to get below 100 per 100,000.
We're heading in the right direction, though.
Yeah.
Just got to keep doing this stuff, all the prevention measures.
Yeah. All right.
All right. Thank you, everybody.
Thank you.
Have a good evening.
Take care.
Now can